Hello everyone, I'm Dr. Mansi and a very good evening to all of you. Today we are back again in the Homeo Talks 2025 webinar series from Homeopathy 360 with collaboration to Patel University. We are very happy to say that today we have another passionate homeopath with us, Dr. Kirti Patel. Thank you so much, ma'am, for joining this platform.
Thank you. Thank you so
And
very much.
And we have Dr. Jolly also to introduce Dr. Kirti Patel, ma'am. So without wasting ma'am time, let's begin this insightful session.
Hello and good evening all. Myself Dr. Jolly Prasad and I am pursuing MD from AHMC with Parul University. So I am very glad that I am again introducing my own professor, Dr. Kirti Patel ma'am. Welcome ma'am. Dr. Kirti
Thank
Patel
you.
ma'am is working as Associate Professor in Pathology and Microbiology Department at Ahmedabad Homeopathic Medical College with Parul University since May 2016. She is also working as a class coordinator of second BHMS of AHMC Ahmedabad. She is working as a faculty coordinator of Criterion 10 of QCI at AHMC. She has been working as a faculty coordinator of chapter PRE, that is Patients' Rights and Education, which is of NABH at Sainath Hospital, which is affiliated with AHMC. Ma'am has also published various articles in national and international journals. She has been working as a faculty coordinator of CPC, Continuous Education Program of Parul University, which is under the program title of Interpretation of Investigations. She has also worked as a research guide of STSH, that is Short Term Studentship Program in Homeopathy, which was initiated by CCRH. She has also been working as mentor for various activities run by Ministry of Ayush for students. So she is as Dr. Mansi said, she is very passionate and also a good teacher. So now I would like to invite ma'am for the webinar on interplay between miasm and pathology in disease manifestation. So I kindly request ma'am to start the session. Thank you.
Yeah, thank you so much, Jolly. First of all, I will thank you, Homeopathic 360, as well as Parul University to provide me this precious platform where I can share my knowledge. Just a minute. Yeah, is the screen is visible, Jolly?
Yes, ma'am.
Okay, okay. Okay, so let us start with our topics today. So today we are going to discuss about the relationship between the pathology and the miasm. So let us start with the introduction. Now, as we know that there's a theory of miasm and the relation or the importance of that miasm with correlation of pathology, it is always a controversial subject because we know that we are not going to prescribe the medicine on the basis of the disease name, but we always focus when we try to find out the similar medicine, what are the importance of the different finding we get it in pathology. So there are some number of people, they are not actually agree with the condition that we are not going to name the disease, and according to disease we are not going to prescribe medicine. But if we understand the both, the subject of organon and pathology, you cannot imagine any disease condition without pathology. So let us understand here in this webinar that what is the exact relation or what our uh, ancestor has said about this pathology, or what Hahnemann has says about pathology in their the clinical work. When we think about the chronic disease, when we think about the different ways by which the miasm is evolved, So we can understand how the importance or what is the exact relationship between pathology and miasm. So the concept of miasm, again, as I told you, it is a controversial topic, but the clinical interpretation of miasm has been a difficult task to everybody. Why? Because we are lacking in the knowledge how we can get the exact miasmatic, the condition of the patient. So again, a simple understanding of miasm in relation with pathologies not only guide us at the same time, it also benefit our patient, basically the patient who are again suffering with the various chronic, illness, where the miasmatic interpretation of that condition and the miasmatic diagnosis that will help you much. Now, before going into that, what our ancestor has, or what is the role of this theories of pathos and chronos according to the Greek theory. So in ancient time, where the knowledge of, the pathology is not that much developed, the people are having the various theories, and according to their theories, they are keep on, theorizing some different type of mechanism how disease is produced. So according to them, there are some theories which is very popular during this Greek medicine, where they are think like there are something which provide heat to us, and that heat ultimately it's our blood, and that because of the circulation that heat is produced, and that heat is responsible for the survival. So if we don't have that heat, then patients are, or the human beings are going to die. So that is a one theory which is based on this Greek medicine. Again, there are some other theories where we try to find out why the people are getting ill and ill. So there is something that is what we call as the dynamic balance. Now we know that if we see physiology, if we even understand the pathology, we know that there is something that is what we call as harmony. So if everything is harmony, whether we think about atmosphere, whether we think about ourself, we understand that if everything is in harmony, the outcome of that particular mechanism is always wonderful. So the same thing can apply with our body as well, where we have the dynamic balance. Miss, what do you mean by this dynamic balance? That is something, the balance between the mind and the physics, the balance between the vital force and the rest of other structure, they are going to follow the instruction of vital force. So that is how if we maintain this harmony, again, there is no, the chances of disease. That is how the health is maintained. After this theory of Greek, the great person, the Hippocrates, the interpretation of the this different type of mechanism the Hippocrates had developed during the this uh, uh, years ago. What they have think about this pathos, from which the word pathology is developed. So pathos is suffering. We know that analogy is a study of suffering. But here they have give some importance to the another word, that is ponos. Now, what do you mean by that? So whatever mechanism is going there in our body, they are going to produce some type of derangement in our body. That is how we perceive according to organon. There are the manifestation of signs and symptoms. So they have given the three factors which is responsible for disease. So pathos, according to them, again pathos is a suffering. So that is what in nowadays, what modern medicine get it, that is disease. So how disease is produced? So again, they have divided into three basic factors. The one is pathogen. Now what is pathogen? According to the language of pathology, they are the causative factor who is responsible for what? To produce some disease. So if you again correlate this concept of etiological factor, we know that in our organon, there are some words like exciting and maintaining cause, or even fundamental cause. So they are the disease producing agent, what we call as. Now, whenever we expose with some etiological factor, now what is going to produce? So there is some mechanism, there is some process that leads to some change in the structure and function. So how we get it that our structure and function get deteriorated? We have some group of symptoms and signs. Okay, so that is how the sign and symptoms are developed. And the third portion, whatever derangement occur, now our body try to restore, our body try to came out from that situation, and again we try to catch the healthy, or what we call the stable state of equilibrium. So that is how the restoration is occur. So that is what the ponos is. So during the Greek time as well, these two words are very famous. The one is pathos and another one is ponos. Now let us understand which are the different stalwarts has taught about, or they have tell something about what is the pathological relation between that miasm and the various type of pathological condition. So the very famous word H.A. Robert, who is again famous for their pathological prescription as well. Now, what this H.A. Robert told about the pathology and miasm, that many a time during the Hahnemann time as well, and Hahnemann himself also, many a time when they try to prescribe the medicine, they has only that criteria of keynote prescribing. And now in that condition, what happened? There are many a time it is inconceivable that Hahnemann ever did keynote prescription. Why? Because at that time what happened, there are some number, when we try to prescribe some medicine, we always keep on finding the unpeculiar characteristic symptoms. But we have to understand that when we find out some uncommon peculiar symptoms, when we have some idea of how the common symptoms are developed, so from where we get that common symptoms, again we have to go back to the pathology, how the symptoms are developed for each and every system. So if we don't have knowledge of pathology, then to find out this characteristic symptom and to find out the exact similar medicine for that, that is also become again difficult. So that's why we cannot imagine, the similar medicine or the homeopathy prescription without the knowledge of pathology. So that is how again it is explained by H.A. Robert. Now then the Richard Hughes, now what they have again told about pathology. Again, Hughes is famous for their pathological prescription. So according to them, the principles of, homeopathy, where the similarity which we always try to find out. But according to them, that if we want to find out the similarity, so how we find out the similarity in our materia medica, we find out there is something which we call as sphere of action of medicine. So that is what the drug action is. So from where we got this knowledge of drug action, unless and until if we don't have the, the pathological knowledge of that particular substance, which is again going to apply on the human being and they are going to produce some disease. So the drug action and the disease action both are very much important, and these both actions are totally depend on the knowledge of pathology. So we can understand again the same, that if you want to prescribe some medicine, again, that to find out that totality, to find out that similarity between the suffering of individual and your medicine, pathology you cannot exclude. Farrington, again the another, the great scientists who have also find out there are what is the relation between the various, the drug which is frequently used for the various pathological condition. Here he has given one example of chelidonium. We know that chelidonium is again a powerful medicine to control the stage of congestion. We know that if we have some knowledge of pathology, we can understand if we are not able to remove congestion, which is a primitive stage of pathology, how they end up with the advanced pathological changes, like how the destruction occur, how the overgrowth is occur. So the one example given over here, that how piles is developed. So in early phase, patient might be present with congestion. If you are not able to remove it, and later stage of life, patient may present with piles. So that is, if we have some knowledge of pathology, we can prevent some advanced pathological changes. Now, this is the basic, the criteria why we have to learn pathology, or what is the importance of pathology in homeopathy. So to classify the nature of disease, okay, whether we have classification of, disease. So whether it is acute condition, whether it is subacute, or it is chronic. If it is acute, then what is the exact, the nature of pathology? Because for acute also we have some superficial pathology, we can have some advanced or the deep pathological changes, where the miasm is also going to change and the medicine is also going to change. So that is the first one, that is nature. Then we also want to understand the prognosis, that is of much more important. If we don't have knowledge of pathology, we don't understand what is the prognosis of this condition, because many a time if you have continuous inflammation in some part, many a time it may lead to the malignancy as well. So when we try to understand what inflammation is, what are the different stages of inflammation, then again we can prevent the condition like malignancy, which is end stage pathological disorder. And now in that advanced pathological cases, we know that prognosis is also not good. So we should focus on this as well. Then the plan of treatment, again, as like prognosis, if we able to understand whether it is a early pathological disorder, whether it is mid one or whether it is advanced one, that plan of treatment is also going to change. Then, but always the miasmatic diagnosis, the selection of potency. We know that if we have deeper involvement of structure, then the type of, or the dose of that particular medicine is also going to change compared to the superficial involvement of any system or organ or cell. Then prevent the disease in early stage, okay, early, or the what we call as the superficial pathological disorder. In early stage, they are preventable ones. Sometimes if we miss that, early phase, we end up with the advanced phase, and again the prognosis is also, bad, and the prevention we sometimes even lost. The study of materia medica, there is a one special branch on which the therapeutic prescription is occur. So to study the different disease and to find out the various medicine have some effect on that organ or system or that disease, that is how the materia medica we can learn from the same. It also help in follow-up and the case after the first prescription. Means we have already done with the first prescription. Now what would be the next? That will again depend on the pathological state of that individual. So these are the different type of, the importance of pathology, and that will help you to diagnose our patient as well as to treat our patient. Now homeopathically, how pathology knowledge is going to help us? So we know that when we try to find out, or when we want to select the similar medicine, the similar remedy, what is the concept on which we always work upon when we think about the homeopathic practice or the homeopathic prescription? It is always based on the concept of individualization. Now, when we try to individualize some patient, we also require something. That is what, when we try to find out some uncommon, peculiar symptoms of that individual that make them person individual. So, how the individualization concept is very much important to find out the exact similar medicine. At the same way, if we understand that, how we can able to understand this is the uncommon or the peculiar symptoms of this particular individual, when we have some data, when we have some knowledge what are the common pathological symptoms is. So this is the again the role of, study pathology in, again study homeopathy according to the knowledge of pathology. So to find out these uncommon peculiar symptoms, ultimately we should have some sound knowledge of pathology. So again, there are always controversies, as already we have told. Now, besides this, certain other systemic changes are produced which can be determined by physical examination. That is what we call as sign. So these are nothing but the pathological changes. So whatever again your patient came with, whatever the word they are going to tell you, they have some group of symptoms. They are what we call as subjective symptoms. There are some group of symptoms, they what we call as they are objective symptoms, and there are different type of the physical expressions you find out that again is a part of examination of patient. If you find out something in that, again that is what we call as a sign of disease. Now ultimately this everything is came from something, that is what the pathological changes are. So we cannot have the sphere of action of a drug on the system until and unless we don't have the pathological changes produced in it. So if you want to even study the sphere of action of drug, which one, it is already written in our books. Like there are some group of medicine having some action of mucous membrane. There are some group of medicine having some action of the mass which is going to produce in our body. So that word is already written in our books. So there is some role of pathology behind it. Now, how will you correlate the word miasm and pathology? Now, if we study the chronic disease, okay, which is written by Honeyman, how the evolution of miasm is occur. We know that in the time of Honeyman, there is no invention of even microscope. Still, Honeyman have written many name of even bacteria and the parasites. So we can understand that how genius the Honeyman is. So now let us come back to our that how Honeyman has evolved that theory of miasm, and how they have in different ways they have tell you about where there is a rule of pathology, and then how you can correlate that exact pathology with miasm, and you again have some better understanding of disease process actually. So we know that health is equilibrium or the equilibrium state of vital force. Okay, so wherever our vital force in harmony, at that time we know that we don't have, that is what we call as health. Now, wherever we have some derangement in this harmonious atmosphere, that is what we call as disease. Now, when we get that derangement, now what happened? The cause of this derangement is something. In the earlier phase, again it is called it like it is something that called as morbific noxious influence. So this morbific noxious influence, that is the word what we call as miasm. So miasm is already present in the human being, but when that able to distract the vital force, and they are able to produce that disharmony, and this disharmony again your patient present with some sign and symptoms. So when you try to find out the sign and symptoms, there is something before that, that is what the miasm having some role. So that's why primary cause of the disease which consider as a miasm. Now this miasm, as I told you, when miasm again exposed with our cell, when miasm is exposed with our system, they are going to produce some abnormal, either the structural or the functional changes. These structural functional changes, how we come to know that our patient having some structural and functional changes, the way patient is tell you about their suffering. That suffering ultimately it is an outcome of something is disturbed at the internal level. So that is how the pathology is developed. So pathology is a result of what? Pathology is a result of derangement of vital force by miasm. So at the time of Hahnemann, when the pathological concept was uh, again, it is depend on the guesswork. No such clear idea regarding the action of drug and the disease as well. So at that time, okay, people are keep on theorizing. If something is happen to any individual, there are different theories of whether it is regarding the pneuma, whether it is regarding the stigma. So they are keep on theorizing. Sometimes there are some theories, or some heat is not there. In that ancient medicine, it is written like there are some force which govern our body. So when it get irritated, when it get disturbed, there are so and so things happen. But we know that when we think about the physics, there should be some scientific explanation for that. So we are at that time we are still seek to find out that scientific the explanation of the condition, the explanation of the thing happened to us. So Hahnemann did something. Hahnemann tried to give some explanation that is logical and that is scientific, so that the modern medicine people get again some idea that how exactly that there is something what we call as miasm. So the after the concept of drug proving, that is a scientific process, we have some the scientificity, how we are going to uh, potentize our medicine, how we go through the whole process of drug proving, how we collect the data, how we verify it. So it is a scientific process. So after drug proving and its clinical verification, whatever data we have collected, it is not just written down by the provers, but we have verified it. So that is how the scientificity is there. And the advancement of knowledge of internal pathology by scientific experimentation. And two, the verifications clear the fact related to the action of drugs and the internal pathology of the disease. We know that there are a number of drugs. In each and every drug, we find out the relationship of that drug with the internal pathological condition. So from that, we get some idea that there is something which is when we take that drug, so there is some relation that this drug is going to act on this pathological condition. So that is how the direct relationship of drug and the pathology. Now, after the birth of this germ theory, or what we call as the cellular theory, we understand the Hahnemann pathology. That is what we call as the alter manifestation of the disease. That is how the signs and symptoms are developed. It is nothing but the functional disturbance and excess and the deviation of cell, which is the structural and functional unit of the body. So wherever our cell either having some functional changes, if they have some excess or some accumulation or some deviation or the destruction, according to that again the different type of diseases are developed. Now with the help of drug proving, again we get the vast number of symptoms, but we know that in the number of medicine we feel that there are some symptoms they are again repeated again and again. So this is again the incomplete work. Now at that time we always know that, but our information concerning medicine, okay, the other drugs are still incomplete. So there are many drugs. We always feel like again if we go for the drug proving of it, we find out some other, the vast number of symptoms. So there are two factors of a correct and the scientific homeopathic prescription. One of them is what? That is the symptom similarity, and the another one, that is the pathological similarity. So we just find out some number of symptoms, and if we try to find out the exact medicine for that, that is something different. And the pathological similarity, in which we try to find out the number of, the pathological state of that individual, and if we try to find out the exact remedy that will cover that. So that is how the pathological similarity is developed. But we know that the later one, where we try to, or we try to understand the pathological state as well, and we try to find out the similar medicine that will cover that pathological state of individual, it is many a time neglected. Okay, so that's why this topic is, we still find out like homeopathy and the pathological relation is still, for many individual, it is a neglected topic. Uh, Now let us come back to the powerful, the miasmatic cause, or what we call as what the word miasm is, from where Hahnemann found out this interesting, the theory of miasm. So Hahnemann interpreted it, the word sora is the fundamental cause of disease, and it categorized as each disease is finding surprisingly concise with the functional disturbances of a cell, which reflect as a hypersensitivity reaction, deficiency, sensitization, and genetic influence. A cell is altered initially by both external and internal factors. The sensitization occur when the factors such as chemical, radiation, virus, hormone, inherited mutations involved. So these are the different, these all are the factor. They are not the factor. They are actually a factor which is responsible to produce some injury to our cell. So now we have to understand at the cellular level that if our cell get injured, now which are the etiological factor? These are the same etiological factor. They are able to produce some disease in individuals. So when our body lose control over the cell division process, okay, we know that we have control mechanism of cell division. Wherever our body, our system, our cell require, they again goes into the cell division process according to the type of cell, because we have varieties of cell, like some cell they are called as stable cells, some cell they are called as permanent cells, some cells they are called as labile cells. Now, if we think about the cell which always ready to divide, they are the type of cell, they are what we call as labile cells. But if we think about the permanent cell, once what the number of cell we get, they are not ready to divide. They are, for an example, if we think about the cells of CNS, where if you have some injury, chances of irreversible changes are very common, because your neurons are not going to be regenerate. So again, the cell division process, it is a control process. But when we lose control on that basic process, from which it is a day-to-day life change, where we are keep on producing some newer and newer cell, and at the same time we are going to lose a million of cell. But if we lose control on this process of cell division, it end up with again formation of mass or tumor or lump. And when this is the phase where our miasm psychosis is came in brain. Honeyman's finding on the cellular deviation. What is cellular deviation? It is something that is going to destruct your cell. It is something that is going to degenerate your cell. It is something that going to, uh, uh, rupture your cell. So ultimately, what we call is, there is something in which our cellular structure, our cell is going to die. There is something in which your cell is going to destruct, or there is some pathology in which again it end up with the destruction. That is how you can correlate the same condition with syphilis. Okay. Now, the emergence of cellular pathology, the disturbance can be explained in the relation with miasm in three categories. The first is SORA. Now, what do you mean by SORA? We know that SORA is a functional change according to the pathology. So, SORA can be explained in the term of sensitization. We know that when we in the further slide we see that what do you mean by SORA, and what is the expression of SORA according to the pathology. So when you think about sensitize, if you want to sensitize your cell, if you want to be sensitive for something, that is what the exact sora is. And that is the, the basic or the very basic pathological changes, how inflammation is produced. Okay. Now in psychotic miasm, it can be explained in the term of proliferation. What is proliferation? Again, to produce more and more, the new growth, the new cell formation, the increased cell division process, uncontrolled increased cell division process. So that is how the mass is developed. So that is the psychotic miasm. And the third one, wherever by any mechanism, whether it is by inflammation even, if you produce some destruction, that is how the third miasm is developed, that is syphilitic. So in general, sora is something related with the early stage of inflammation. Psychotic is related with the proliferation, and the third syphilitic is again related with the destruction, or what we call as the irreversible pathological changes which cannot be come back to normal. So again, pathology basically divided into two type, or pathology, or what we call as the cell injury. Okay, the cell, when our cell get injured, there are two possibilities. Either cell go for the reversible changes, or either cell go for the irreversible changes. Now, what is the outcome for reversible? Whatever changes are occur, if you are able to remove etiological factor on time, then again your cell come back to normal as it is. Now, whether if you think about irreversible change, then the same etiological factor, if it get prolongated, then from reversible, now your cellular changes enter into the irreversible phase, where though you recover from that condition, but with some residual effect. That is how we know that acute inflammation is healed by their own. But if we think about the chronic inflammation, we again end up with some fibrosis. So that is again the permanent change that cannot be reversible. So according to that, again, the inflammation, proliferation, and degeneration, these are the broad terms on which you can think about the sora, psychosis, and syphilis. Now let us understand, if we have some inflammatory changes, which type of miasm? As we know that inflammation, again, the sora is in base when you think about inflammation. But we know that we also have, the different type of inflammation. So it is not like every inflammation having only soric miasm. If we have inflammation, but if we have deep inflammation, which is remain there at that level for a long time, again it converted into chronic, and chronic may heal by fibrosis. We know that. Now in this fibrotic involvement of cell, this is not a soric miasm. So that is how your inflammation can start from the sora, that is a base, and they can move further, and they may end up with syphilitic one. Okay. So the definition of inflammation, we know that it is a response of our living mammalian tissue toward any type of etiological agent. So when we get exposed with any type of etiological factors, our bodies try to produce some changes at the cellular level, and that is what we call as inflammation is. Okay. So inflammation, as I told you, it is acute, it is subacute, and chronic. In acute inflammation, the onset is always sudden and the course is short. Either your patient is going to survive, or again we are going to lost our patient. So it is survival or death. Clinically, the sign of inflammation, we all know that they are present associated with some constitutional changes. Okay, we know that the 5 cardinal sign of inflammation. So microscopically, what you can find out in that acute inflamed area, it is a different type of cellular and vascular changes are occur. Now, at the cellular and vascular changes, we have change in our vasculature. We also have change in the structure of our cell, the internal component of our cell, as well as we have some aggregation of different types of inflammatory cell which will sustain the process of inflammation. So again, here it is acute inflammation. So we have infiltration of neutrophils. Now we know that acute stage, if either we recover from that, or if it get little bit prolongated from acute, we enter into the another phase, that is what we call as subacute, or further prolongation, we end up with the chronic stage. So when we try to correlate the acute inflammation with acute disease condition, homeopathically, we know that there are some they are called as acute disease, some they are called as chronic. So this acute inflammation we can correlate with the acute disease, which is having sudden onset, due to sudden explosion of latent sora. We know that. Now, what do you mean by latent sora? We know that for sora, Honeyman had given that is what the primary expression of sora, then the latent sora, and then the secondary explosion of sora. Latent is the dormant phase where the miasm is already there in our body, but they don't have any manifestation of it. But when we provide some atmosphere, again we have outbreak of that latent sora, and now it become again functional. So again, the sudden explosion of this latent sora, that is how you can explain in acute disease condition. Fast progress and end in okay, either we observe in death or recovery. Such changes are commonly observed in to all the acute inflammatory disease. Okay. Now, the spread of acute inflammation leads to what? We know that if we are not able to remove that etiological factor which is responsible for inflammation, they can spread, and they can spread in. And how we can able to understand that we have crossed that limit. So patient develop different type of manifestations for that. So whether it is cellulitis, whether it is lymphangitis, a pyemia, or what we call as septicemia, we know that infection is a most common cause of inflammation. So here also, when this type of symptoms are developed, again that is a sign of spread of acute inflammation. Now the nosological terminology varies, but the basic cellular changes remain the same. The example are like the common example you can think about tonsillitis, pharyngitis, laryngitis. Okay, these all are the condition in which we expose with some etiological factors which is going to produce again inflammation. So we can say that the acute disease condition where the acute inflammatory changes are present, which is comes under which miasm, that is SORA. Now in subacute variety, which is just after the acute inflammation, it is 1 to 6 week more. The less explosive and the okay, it lasts longer compared to the acute one. Microscopy here also you have vascular exudative as well as the proliferative changes are present. Okay, which also present in psoric miasm, right? So the subacute phase also comes under SORA. Now, as I told you, if you go across the that from acute to subacute, and now you go further, then now you end up with the chronic inflammatory stage, which is again not completely as like what you can think about the acute one, because here you goes into that process from reversible to irreversible changes, and you may end up with some structural deformities where you get some deposition of the fibrin into the cellular structures. Okay, so that is how we start from the SORA, because again it's inflammation, and sometimes we may end up with the end stage, that is syphilis. The second one is proliferative changes. Now, what is proliferative changes? As I told you, the word proliferation, it is to produce, to reproduce, to increase. Okay, so whenever we produce this new and new cell, okay, so when we try to produce some number of newer cells, new growth, multiplication, now these all thing unite together, ultimately they are going to form some mass. So wherever, so in other words, this increase in number of cell or the increase in this proliferative material, the multiplication, that suggests what? That suggests something that is extra, something this is excess, something that going to accumulate somewhere. So these all type of words, again, it is suggestive of what? So we know that this condition is also, this proliferation is also common with the subacute phase of inflammation. So ultimately, wherever in any condition where you find out this mechanism, in which there is some extra thing is there, your body is producing something extra, some in excess, which is going to accumulate somewhere in our, the cellular structure, you can think about miasm, that is psychosis. Microscopically, the changes are characterized by what? That is a proliferation of the connective tissue. We know that when the number of cells are going to produce, the newer cells are going to produce, we know that there is proliferation of blood vessels are also there. Pus is also present in chronic suppurative inflammation. In many cases of chronic inflammation, we know that even necrosis is also present in the number of, the chronic inflammatory stage. Okay, now we know that in these all type of changes of inflammation, which we can find out in chronic one, These all things ultimately when they goes for the process of repair, it is not going to heal by the same cell, but it is going to replace by the fibrosis. It is going to replace by the fibrotic cell. So that is the outcome of chronic inflammation. So miasmatical is such inflammatory process which not only comes under the single miasm sora. Here it again begin with sora, but when it become again latent with the proliferation, it starts with psychosis and ultimately they end into syphilis. So if you think about only proliferation, it start with psychosis, and we know that because of proliferation, cell may die, cell structure may get disturbed, and that is healed by fibrosis. So here we can think about the destructive miasm, that is syphilis. So the last one, that is how the degenerative changes occur. Now we know that degeneration, what the word degeneration suggests, having lost the qualities that are normal and desirable or the proper to its kind. So the what is the exact structure of anything? If it is not there, that is what we call as, again, there is something which is abnormal. That is something that is not desirable. So if the same thing happen with our of degeneration. So this indicate what? This indicate the pathological changes which occur in the cell or tissue in the process of sickness due to the non-fatal injuries or the adverse influence. So there are the varieties of etiological factor they are able to produce this type of destruction at the cellular level. So that is how the whole process of degeneration is maintained. Now in this process, there are again two type of effect can occur. The first effect, that is a direct toxic action upon the component of the cell. We know that in our cell, we also have nucleus, we have Golgi apparatus, we have endoplasmic reticulum. These are the component of cell. So if we have direct toxic effect on that particular component, that is a one type of action or the effect. The another effect is the secondary changes resulting from the deranged intracellular metabolism, which is characterized by accumulation of substance. Now here what happened? Either we have direct, attack on the component of cell, or the another, effect how it is occur, then we have some derangement at the metabolic level. We know that every cell has some role in metabolism. So if your cell get disturbed, then the output of that cell, that is the function what that cell is going to produce for the different system and organ, that is the intracellular cell metabolism. So if your cell is get disturbed, then ultimately the metabolism or the function of that cell, that is also going to be disturbed. So this is the two way how this the injuries is occur at the cellular level. So again, the main cause of degeneration, which are the causes? The all type of cause we can think about, any type of mechanical factors, any type of, the chemicals, the microbial agent, the nutritional factor, even the psychological factor. These all are the factors they are able to produce cell injury. It is again, it is going to differentiate whether they produce some reversible cell injury or whether they are going to end up with some irreversible changes. So degeneration came at that stage. So degeneration, how we can come to know that this person, this organ, this tissue having cell injury, your cell is going to represent something at the histopathological level. There are some signs like cloudy swelling, fatty degeneration, necrosis. These are the different type of, the pathological finding which you come at the time where you go under the microscope and to see the diseased tissue. So what is cloudy swelling? So as I told you, when your cell get disturbed, the cell membrane also get disturbed. Now, what is the function of cell membrane? Cell membrane not allow any particle from the extracellular fluid to enter into the intracellular fluid. Now, here is a part of degeneration. What happened? In this cloudy swelling, that water molecule get enter into your cell and your cell is become enlarged. And from that appearance, the name is given cloudy swelling. So now here what happened? There is some, you know the accumulation of water into the cell. So as the change observed into this particular condition, again if it is of acute infective condition where you find out this type of changes, we know that it belong with which miasm, that is again sora. Another one, again it is fatty change. Now the name itself suggests what do you mean by fatty change. It is a type of degenerative process in which there is accumulation of the fat molecules inside the cell membrane. So here again there is accumulation, there is infiltration. So we know that that is a basic, the pattern of psychotic miasm, where that person, that physics of that individual, they try to accumulate. So there is some aggregation of different type of, the abnormal component into the cell. That is how the psychosis is developed. So again, if any individual having fatty changes, that at that time, again, you can think about the miasm, that is psychosis. The last, that is necrosis, which is also called as a microscopical death of cell. So after the end, when you think about reversible and irreversible changes, necrosis is a end stage pathology where your cell is ultimately going to die. So here what happened, because of destruction, the cell is going to die. So the all such, the cellular changes which indicate destruction, which indicate death, which indicate, the disquamation of any structure, everything again comes under the one miasm. That is how the syphilis is developed. Now we have understand what do you mean by SORA. Okay, that is the typical inflammatory stage, early stage of inflammation. Then how the psychosis is developed, where our body try to accumulate and collect everything and put it into the cell. And the third stage where ultimately your cell is going to die. So that is the syphilitic phase. So now how will you identify, the miasm of individual? So there are some factors. There are the three factors how you can come to the stage where you are able to identify this is SORA, this is psychosis, and this is syphilis. So the type of pathology develop in affected system, organ, tissue, or body. Type of pathology means what? Whether it is early stage pathology. For an example, if we take inflammation, whether it is acute, whether it is subacute, whether it is chronic, whether it is proliferation, whether it is again destruction. So we have to try to find out what is the exact pathological change. And that pathological change, type of pathology, whether it is early stage pathology, whether it is advanced, because we know that in early stage there is involvement of function, in later stage there is involvement of structure. Then pace, speed, and of the development of disease, including the pattern. So what is the pace of disease? See, every disease have their space. The speed of involvement of structure, the speed of involvement of the cell, that is also going to decide the outcome. Okay, the increase the speed, the miasm is also toward the destruction. Okay, the early involvement or the slow involvement, again, we think about SORA. And in last, the characteristic symptoms of disease. Whatever manifestation of disease, it is going to decide which type of miasm it is. Now let us understand, if any person you think about SORA, then what should be the some, the peculiarity of SORA, and that will lead your, the similarity between the Suric medicines. Now we know that SORA having that, the pattern of hypo deficiency, what we call as. We know that deficiency is equal to SORA. So in any condition, in whatever disease it is, but where do you find out deficiency? Here what we word use, that is hypo. So whether it is hypoxia, hypotension, hypoperfusion, atrophy, anemia. See, these are the some condition in which there is something is lacking. So wherever you find out this pattern of lacking, insufficiency, deficiency, you can think about SORA. Now these are the some other symptoms like, deficiency disorders, the lack of certain element. We know that we can think about the all nutritional deficiency, because we know that the oxygen and nutrition, which is a basic requirement of our cell to function. So if we are not able to provide that, we end up with the number of pathologies starting from inflammation till the end stage pathological disorder like neoplasia, or what we call as necrosis. So again, you have to categorize like this and to understand at what state your patient is, and you have to find out the exact miasmatic state of that individual. Profuse discharge, which ameliorate the complaint, chilliness, aggravation at night, and on standing, relief or the amelioration with the application of warmth and pressure are the some of the characteristic of the SORA. Sharp, sudden, intense, irreversible. We know that the psoriatic patient are always hypersensitive. That is also the another, the pathological state where you can think about SORA. So SORA we have used the word sensitization. So when people is become sensitized, if they are sensitive, okay, so the sensitive or the hypersensitive individual, and there is a, the pattern of deficiency, you can think about Sora. Okay, this is the classical what Hahnemann has already told in the chronic disease. The Sora is the most ancient, the most universal, and the most destructive, and yet the most misapprehended chronic miasmatic disease, which for many thousands of years has disfigured and tortured the mankind and become the mother of all the thousands of incredibly various chronic diseases that we already know. Now the second one, that is psychosis, the basic, the pattern is proliferation, how your body is producing more and more. Okay, so here we have that concept of hyper. Whenever we think about something excess, okay, something is more. So where we have excess, it also the proliferation is occur. Okay. So again, we know that from where this psychosis miasm, Hahnemann has developed from that, the typical theory of venereal disease and what is the role of gonorrhea and all that. Okay. So the proliferation, exaggeration, deposition of cell and tissue. This is how the cell proliferation occur, and that is how the accumulation occur into the cell and how the psychosis is developed. Okay. Rheumatic state, the exudations of glands. Then we can think about the hypersensitive reaction. Okay, the sudden slow onset, the progress and the duration of disease or the symptoms, which is sluggishness, the backwardness, the retardation, retention. These are the different word you can use for the excess. Okay, this stasis, you know, cramps, convulsion, all type of hyper, like, hypertrophy, where your number and the size of cells are going to increase, like hyperplasia. Okay, so these all are the word where something, the pattern of excess, the pattern of accumulation, a big theme on which, on this pathological ground, you can think about psychosis. And the syphilitic one, syphilitic, we know that it is a destruction. The figure is also showing you how your cell is, about to rupture. So the varieties of degenerative changes, that is what we also call as the changes of life, the deformations, the destruction, rupture, okay, the death of cells and tissues, okay, the ulceration. So these are the different type of the structural as well as the functional pathological change, where destruction is a main theme. We can think about the syphilitic miasm. Disease, okay, the dysplasia, the dystrophy, dyspnea, dysphagia, with dyspnea, these are the different type of condition which is comes under the pre-malignant pathological lesion. So now they have direct relation with the syphilitic miasm. The mesodermal origin, okay, the asymmetry. We know that when your cell is about to rupture, we don't have the the physiological structure of cell, the internal component of cells, they are also about to rupture. So that is how the deformity occur. And ultimately, at the end of that, your cell is going to die. Mental and the physical paralysis, the amelioration through the abnormal discharges. When many a time we find out the symptoms, patient feel better wherever there is some abnormal discharge. So that is how from that symptoms you can think about the miasm, that is syphilis. Now this is the very simple understanding. There are some, I have find out some common group of pathological finding as, and you can categorize whether it is SORA, psychosis, and syphilis. So the functional disturbance, the deficiencies, the inflammation, the metabolic changes, these all are comes under SORA. While if you think about psychosyphilis, again that is proliferative one. While in syphilis, that is destruction. So it is ulceration and destruction and disquamation of cell. Okay, these all are the common word we can think about. Which the layer of involvement. So if again it is the outermost, that is ecto, then endo, and then meso, that is the innermost one. The type of secretion, if you think about, if you have serous secretion, that is more of sora. The purulent, where the pus formations, it is very common with the psychosis. And again, if the intensity of that, the septicemia get increase and increase, then that discharges become acrid and putrid. Okay, very smelly, foul-smelling discharge. That is how the syphilis is present. If we see the skin of individual, if it is unhealthy, dry skin, itching, burning, that is comes under sora. Oily skin with a copious perspiration, excretion, that is psychosis. Ulcerated skin, again destruction at this, the epidermis as well. Pus and blood came out from that. The part is necrose or that part get dye and become black, and again it is superadded with infection and has how the gangrene is developed. So that is comes under syphilis. If we see our pulse, if it is slow pulse, that is sora, rapid pulse, that is psychosis. It is irregular, then it is syphilis. If patient is anxious, fearful, highly sensitive, irritable, then we can think about sora. We know that psychotic people are very suspicious, they are very secretive, the cross, they cannot share their whatever they feel inside. These all are the typical, the mental state of psychotic individual. The patient having fixed idea, stubborn, okay, the melancholic individual, okay, that is how the syphilitic presentation is. Slow, sluggish, insensitive, that is sora, hurried and hyperactive, that is psychotic, gloomy and destructive attempts, they are the syphilitic individual. Sad, grief, and suicidal thought, okay, we know that how the intensity of symptoms get increased, we can fall into the syphilitic one. Acute, subacute, and chronic. Cloudy swelling, fatty change, and necrosis. Already we have discussed in detail. So now, therefore, the active miasm will be identified from the chief. So how we can able to identify the miasm? We can identify from the chief complaint, which is selected must be cover up the characteristic symptoms and the active miasm. So when we try to find out the exact miasm of the condition, we have to focus on the chief complaint as well as the characteristic symptoms which we are going to get. But we know that how we get characteristic symptoms when we know the common symptoms of condition. The chronic cases, the dormant, okay, as well as the active miasm must be considered to find out the exact similarity between the present state and the miasmatic state. In certain cases, where the dormant miasm, again, with family history and past history, may not be covered by the indicated drugs, still, okay, there are many a time this thing happen that the dormant miasm, okay, from family history and past history, we cannot able to get it. So still, we can prescribe the drug which cover what? The active miasm plus the constitution. So these are the different ways by which again you come to the miasmatic, the diagnosis of individual, and that will help you to find out the characteristic medicine. So again, pathology indicate pathogen, the process of disease, that is what we call as pathogenesis, and the response of individual against this particular, the nosological terminology is not sufficient. So again, the correlation of the Hahnemannian concept of miasm with pathology, the origin, the development, and the stage of disease and the clinical manifestation are to be considered while correlating the concept of miasm. So just to find out etiology and the pathogenesis, and we came with some, the correlation with the same with miasm, it is not enough. We have to understand from where this disease is produced, from where this suffering is developed, how it get developed, what is the stage of that disease, and after when we collect this all data, we have to make totality in such a way that will again give you some miasmatic diagnosis with some similar medicine. So again, this topic again elaborate on the early understanding of chronic disease by the Samuel Hahnemann, the founder of our homeopathy. How this idea on parasitic microorganism. As I told you that Hahnemann in their early writing, they has also mentioned about the various, the disease producing agent like microbacteria are there. They have not used exactly the word parasite, but at that time they has used the same word bacteria for parasite as well. So though the invention of microscope is not there, but Honeyman, how finely they have described what is the role of bacteriology and how will you combine that knowledge of pathology with homeopathy. So it's a failure of modern medicine to effectively cure still many infectious disease despite the advancement or even the fine criteria for the prevention and hygiene as championed by Honeyman. So we can understand, though the modern medicine have the powerful tools are available to find out to research on that particular aspect, but the earlier time during the time of Honeyman, though the Honeyman don't have this all type of the advanced tool, still they have wrought something about this all type of organism, how they are going to produce some derangement in human being and how they are going to produce some disease, and they have already labeled the the Koch's postulate and how the tuberculosis is developed, how the leprosy is developed. Though we know that these all are the type of microorganism we cannot see by naked eyes, we require microscope for that. So that is how the genius Honeyman is. So texts call for the deeper exploration of the Honeyman's theories, now supported by the modern scientific understanding to improve the treatment of chronic as well as the infectious disease. So these are the some references from where I have prepared this whole material, the various common books from where the fine explanation of miasm is given. So thank you so very much.
Thank you so much, ma'am, for this wonderful session. You have elaborated many points and many insights from the miasm point of view, plus the pathological point of view. I request all the attendees to please have your doubts and any queries related to the session. In the question answer box, you can put your doubts. So
I
anybody
think no
from
one
the
has.
participants?
Yeah.
Yes, yes, Dr. Jolly, please proceed.
Hello. Ma'am, there is one question that what would be the miasm for vitiligo?
Yeah, for vitiligo, again, we can think about it is a trimiasmatic disorder because we know that there is a genetic influence, but again, the sora at the base. So it is a soric miasm, but we can think about even psychotic and syphilitic if we think about the mental state of that individual. Anything else?
Uh, Only one question, ma'am.
Yeah.
Oh, I think. Ma'am, there is another question.
Yes.
Could it be soda for premature ovarian failure?
Premature ovarian failure. Yes, when we think about, when we think about the function of ovary, we know there is something that rule, the endocrinal organ, that is hormone. So ultimately, there is again the same theme of deficiency. So when we think about deficiency, there is the deficiency of the ovarian hormone. Okay, so that is again comes under SORA.
Okay, ma'am.
Thank you so much. Yeah.
I think, ma'am, we're done with questions.
Okay.
Okay, ma'am. So now we have no more questions, and
Yeah.
I hope all the attendees have enjoyed this session. This session was really very informative. Thank you so much, ma'am, for your valuable time. And would you like to share your experience with Homeopathy 360?
Thank you so much. Thank you for providing this opportunity. And thank you, Parul University as well. Thank you, Mansi ma'am. Thank you, Jolly. So shall we end up this session?
Yes, ma'am. Sure. Thank you so much.
Thank you,
Good
ma'am.
night.
Thank you. Thank you.